Good morning to all. Today we'll be discussing about the bed making procedure. We'll see the definition, purposes, articles and the steps involved in the open bed making procedure. The first one is the definition. Bed making is the systematic way of preparing the bed based on the condition of patients which adopts the scientific principles of the nursing. We'll go to the purposes: to promote the comfort and safety, to give warm neat appearance, to save the time, money and effort, to receive the patient during emergency and to prevent the bed sore. Now we will see the articles which are involved in the open bed making. After articles, we'll see the steps which are involved in the open bed making. So the articles are a clean tray containing a bottom seat, Macintosh, draw seat, top seat, blanket, pillow with cover, bowl with antiseptic solution, kidney tray, 2 damp dusters, 1 dry damp duster and 1 wet damp dusters. Now we will show the articles which are required in the open bed making. So these are the articles we'll be using in the open bed making procedures. So these are the additional articles we'll be using on the open bed making procedures. Before starting the procedure, assess the patient general condition, explain the patient about the need of bed making, assist the patient to get out of the bed if he or she is not able to get out by himself or herself. Now make the bed in the flat position. After this, we'll start the bed making procedure. First of all, carbolization of the bed is done by the help of the antiseptic solution. Now we will move on to the steps which are involved in the open bed making procedure. Articles which are involved in the open bed making procedure should be placed on the right hand side of the patient bed. Firstly, we have to spread the bottom seat. As you are seeing, we are spreading the bottom seat. Now firstly, we need to tuck on the head and side of the bed. Then we will spread the bed towards the foot end side. Then we will tuck on the foot end side of the bed. After talking on the both the side, now we will move on to the mitral corner. So it is the most important part of the bed making procedure. It should be in a diamond triangular shape. So you have to make the mitral corner on the both side of the bed, on the 4 corners of the bed. Making the mitral corner, now we will tuck the bed sheet under the bed. Now we will do the same procedure on the left hand side also. So before making the mitral corner on the left hand side, we need to pull the bed sheet on the left hand side so that the wrinkles will not be present on the bed sheet. So here also we have to make a mitral corner which is in the diamond triangular shape. As I already told that it is an important part, so you should be very careful while making the mitral corner. So after making the mitral corner on the left hand side, now we will tuck the bed sheet under the bed. So for this we need to hold the cut with the one hand and we need to tuck the bed sheet with our knuckles to prevent any injury. Now take a Macintosh and spread the Macintosh over the bottom sheet. So after taking the Macintosh, we will take the draw sheet to cover the Macintosh. Now spread the draw sheet over the Macintosh in the same way. So its draw sheet should be larger than the Macintosh. Now we are spreading the draw sheet. So draw sheet should cover the Macintosh. Then after spreading the draw sheet, you need to tuck the draw sheet in the same way as we did in the bottom sheet. So before tucking on the left hand side, you should pull the draw sheet on the left hand side so that the draw sheet will be wrinkle free. So you need to tuck the draw sheet on the same way by holding it with the one hand and with the knuckles. After setting the draw sheet over the Macintosh, now we will take the top sheet. We will spread the top sheet. The use of the top sheet is to cover the patient. If we cover the patient only with the blanket, it may irritate the patient, so we will place the top sheet below the blanket. So we need not to tuck the head and end of the top sheet, because we will be folding the head and end of the top sheet along with the blanket. In the same way, we will tuck the foot end side of the top sheet along with the blanket. Now take a blanket. So always we should remember that blanket should be 15 cm below the top sheet towards the head and side. Now spread the blanket towards the head and side. Firstly, you have to fold the blanket along with the top sheet. After folding the top sheet towards the head and side, now spread towards the foot end side. Take the blanket and the top sheet together towards the foot end side and tuck it together. Now we are talking the blanket and the top sheet together. So after talking the blanket and top sheet in the foot end side, we will move on to the mitral corner. So as I have already told, it should be in a diamond triangular shape. So you have to make the mitral corner together by taking the top sheet and the blanket. In the same way, in the left hand side, you need to make a mitral corner in the diamond triangular shape. So now we will the blanket along with the top sheet. So in this way we have to fold the top sheet along with the blanket for the open bed making. So in this way we will fold the top sheet and the blanket together in the open bed making. So always we should remember that we should never tuck the blanket and the top sheet in the open bed making, as it is already occupied bed making. Now we will take a pillow cover and put the pillow into the pillow cover. While placing the pillow, the opening part of the pillow should never face towards the door side. So it should always face to opposite to the door side or the. So this is how we will be doing the open bed making procedures, by considering the important things, by keeping the important things in our mind. So for the patient safety and to make the patient comfortable, to prevent from the serious diseases like bed sores, and to give the ward neat and clean appearance. After completing the procedure, you have to go for the hand washing and place the patient in a comfortable position and replace the articles.